Hello, Charles County. I'm Doria Fleischer with Media Services, and I'm thrilled to be joining you today with a collaborative conversation about a community issue. We're here today to talk about homelessness, a topic that a lot of us in Charles County worry about and have questions about. And today we've brought together some of our wonderful local subject matter experts to help explain this complicated issue and also talk about what their agencies and departments are doing to support the people in our community. I'm joined here today by Dr. Tanisha Sanders, the Director of Department of Social Services, Dina Barclay, the Director of the Department of Community Services for Charles County Government, Blair Copeland, the Director of Women and Family Shelters for Catholic Charities, supporting Angels Watch, Corey Young, the Chief Operating Officer of Lifestyles of Maryland, and Bethany Goodwin, the District Coordinator of Homeless Foster Care and Community Schools with Charles County Public Schools. Thank you all so much for being here today.
Thank you.
Thank you.
So we've talked about doing this for a long time, and I so value and am grateful that you've taken the time out of your schedules and your busy jobs to come in so we can do this. The purpose of today's conversation is to help provide some education for our community about what homelessness is, what homelessness isn't, and also what your agencies are doing successfully and what challenges you're facing as we handle this really difficult topic. I'd like to start by just asking each of you about some of the language that we're going to use today. So we've talked about the idea of homelessness, but I know in each of our agencies and departments, we talk about that differently. How do you define homelessness, and what vocabulary do you use when you're discussing this? And Dr. Sanders, I'd love to start with you.
Okay. So Charles County DSS defines homelessness as anyone sleeping in a tent, outside in a car, laundromat, or anywhere that is not meant for habitation. It also includes staying in a homeless shelter, couch surfing, transitional house, or motel paid for by a nonprofit or government entity.
So you have a very kind of strict definition.
Yes.
Excellent. And Ms. Barclay, how do you describe homelessness?
I would say for the Department of Community Services, our definition is very similar to Dr. Sanders because most of our funding for our housing programs comes through the HUD, the federal government. We tend to use the definition that HUD uses, which is literally homeless. So people who are unsheltered, living on the streets, as she said, in tents or things like that, tends not to be the people who are staying with family or sharing spaces. It's really more the literal homeless outside.
Thank you. And Ms. Copeland, how do you describe homelessness in Angels Watch?
Yeah, it's similar. Because we work with our partners, we are given sort of a group of people who are hoping to enter shelter. I think one note is that we try to talk about people who are experiencing homelessness as opposed to people who are homeless, because it's a state that you can move in and out of.
Absolutely.
Yeah, that person first identification. Yeah. Thank you. Ms. Young, how does Lifestyles define or describe homelessness?
So very similar to everyone else. I think oftentimes we talk about it as people who don't have a permanent address. Our funding sources, however, have a very specific criteria, which sometimes causes it to be the challenge for us in serving people, because it's typically that literally homeless definition that qualifies people for certain resources, including shelter, including financial assistance, which includes people who are living in emergency shelters or living in uninhabitable places, or people who are fleeing from domestic violence situations. So the couch surfing folks, or people who are staying in and out of hotels paid by themselves, typically don't fit into those particular criteria, which is kind of where we've had some challenges.
So what the people you serve are not necessarily able to meet the definition that's provided to you.
Right.
Ms. Goodwin, how does Charles County Public Schools define that?
It is more broad. We follow all public schools across the country follow the federal McKinney-Vento Homeless Assistance Act. And that federal guideline defines homelessness as students who lack a regular, fixed, and adequate nighttime residence. So for our students to be defined or eligible for homeless education services, that means they can be sharing housing with others. They can be living in a motel, living in a shelter, or living in public spaces, or unsheltered, or living in inadequate or substandard housing.
And it's interesting that while, in having the opportunity to work with each of you, I know that you serve many of the same people, that we share clients with these services, and yet some clients would qualify for services under one agency and not another. And I assume that leads to, at times, a level of complication and confusion.
I would say complication, but it also leads to opportunity because we are working closely together as a team. And if we can't serve them through one of our programs, we reach out to our partners regularly. We do have a lot of mutual customers, and we try to collaborate to come up with solutions, even if they don't fit in a particular.
So even if a person doesn't qualify in one way, hopefully we can find a service that they do qualify for.
Yes.
And I heard each of you say through that kind of a theme of a lot of times it has to do with funding, that we have to define the person through how the funding is available. Is that an accurate statement?
Correct.
It is.
Yeah. And that also, and I appreciate you bringing this up, Ms. Copeland, the idea of making it person-centered also, that while the definition may seem harsh and black and white and clear, that in each of your agencies, you're also seeking to give that person-centered approach and the idea that it is a state that any one of us could end up in or end up out of at any time.
Absolutely.
Excellent. Thank you for sharing. So when we talk about homelessness in Charles County, knowing that there's these different literal definitions of it that we have to follow, but then also the different programs and services that you provide serve different people. How do you think homelessness affects Charles County and its residents from your agency's perspective? So if I said to you, talk to me about the issue of homelessness in Charles County for your agency, for your department, how would you describe that? And Ms. Goodwin, if I can start with you.
Sure. It's very difficult and very challenging for our families and students experiencing homelessness. Looking at Charles County Public Schools, I think people would be surprised that currently we have 960 students that are experiencing homelessness. Not all of those students would probably consider themselves homeless because many of them are sharing housing with others. But we have several. We have like over 90 in motels. We have identified over 70 children this year living in shelters. And then we have over 30 students that we've identified living in substandard and inadequate housing. And so the challenge is we find that there are many families who are chronically homeless, and they move and they transition from place to place several times. And so it's not unheard of for students to be chronically homeless year after year after year, which is very challenging and difficult for our students when they're trying to just have stable education and a stable living environment, and just continuity of their instruction and be able to learn and to attend school and to be promoted and move on with their goals. So it can be a challenge.
Mm-hmm. I would imagine for any person, but especially for our younger community, how challenging it is to do anything when the number one thing on your mind is, where am I going to sleep tonight? Or do I know where I can call home?
Yeah. Yes. So we spend a lot of resources, and the McKinney-Vento grant funds that we receive are from the federal government, and then they go to the state, and we receive them from MSDE. And they're limited funds. And we also receive funding from the Title I McKinney-Vento funds. So those funds we use to make sure that the students are able to be transported to school, and to stay at their schools of origin if they have to move, so they don't lose that stability within their schooling. They can stay at their same school if it's reasonable. And then we use a lot of the funds to pay for clothing, school supplies, and school fees and graduation fees, so they can come to school, and extracurricular activities too, so they can participate in them, just like their non-homeless peers.
I appreciate hearing that. So the school system's goal, it sounds like, is we can't necessarily help you with the housing, but we can help you with everything you need to get you to the school.
Correct.
So that while you're there, you can have a level playing field as your peers.
That's correct.
Thank you. Ms. Young, how does your agency talk about homelessness in Charles County? How does it impact your community? What's kind of your big picture of this issue?
Sure. So much of lifestyle services revolve around serving persons who are homeless. So as an agency, we offer everything from street outreach services to providing emergency and transitional housing shelter services, and then hopefully transitioning people to permanent housing. So we do have funding from HUD that allows us to transition folks using paying for security deposits and first month's rents. Some of the challenges that we face in doing that is that in this community, we do not have a walk-in shelter. So if someone calls today and says that they need somewhere to go for that night, it's pretty challenging to say that there is somewhere for them to go that night. We have a great coordinated system in Southern Maryland. So right now, all of our shelter services are coordinated across Calvert, Charles, and St. Mary's County. And so the goal is working as a collaborative is that when people request services, there is now a joint wait list process. So we go through that wait list, determine eligibility based upon needs, vulnerability. Typically persons or households who have children or vulnerable adults kind of get first preference, as well as our domestic violence survivors. But typically on any given night, there's not a direct, I can walk into a shelter tonight and receive a bed, which is a challenge because as people are presenting for services, they are requesting it at that time. And so as an agency wanting to provide services, that's typically one of the challenges in communicating to the public that there is not somewhere where someone can just walk in that evening and receive services. There are some other resources that we assist people with. So if people are in need of day center services, some of the basic needs that are provided through public schools, also some of our agencies provide it. But having somewhere to go that night is a challenge. I think also from our perspective is you can't really talk about homelessness and unhoused individuals without talking about housing. And so that is one of the barriers for us as an agency to help transition people out of homelessness is having somewhere that is adequate, safe, and affordable for people to transition to. And so in working with local landlords, there's typically income requirements, there's other restrictions, and those create barriers for some of our households. So if persons are on limited income or if they're on Social Security, very rarely right now are they able to transition without any form of a regular subsidy towards that. And so as an agency, trying to be innovative and creative and encouraging house sharing and other opportunities, typically that's one of our challenges. So if we have a challenge transitioning people out of the shelter, then we have a challenge then bringing other new households in.
That makes sense. So it's a combination of we don't necessarily have a place to put you immediately when you need it, but then also when you are at a point to transition, our housing availability is limited at the same time. Thank you. Ms. Copeland, how does your agency, how does your organization talk about homelessness and
much
the impact it has?
Much like Corey is speaking about, it's really difficult for anybody who is working at poverty level, right? So making minimum wage to be able to afford a safe place to live in this community. So it's really difficult to have our system, as Ms. Young talked about, move efficiently. One, to move someone in and get them stabilized, and two, to move them out. So our agency is trying to, work with our partners and figure out the best way to support people moving out of the shelter as quickly and safely as possible. And that means giving as many services, much services as we can to get them better prepared to be stable. But that takes time, right? And that makes the system move slower. So trying to figure out how to move people out safely and quickly
It's a big challenge.
It's incredibly challenging, right? So we want people to be in shelter for a short period of time. That in itself is traumatic, one, experiencing homelessness and then having to go into a shared living situation. And we don't want to prolong that. So figuring out what supports are needed to get them to move out quickly if possible.
And to clarify, Ms. Young said that we don't have a walk-in shelter, but you're using the word shelter to describe Angel's Watch.
Sure.
How does that work?
Right. So what Ms. Young is talking about is, a drop-in center where you could come and get a bed that night. That is not what this community has, but we do refer to it as shelter. So it's 120 beds at Angel's Watch. The beautiful part about our shelters, you have your own private room that locks with their own bathroom, and some of our rooms are adjoining so we can accommodate larger families, but there is a wait time. And so you go through coordinated entry, and then when we have a space, we move you in and we try to assess your needs and move you out as quickly as possible.
Thank you for sharing.
Sure.
Ms. Barclay, how does the Department of Community Services think about homelessness, talk about homelessness, provide resources?
So I'm going to kind of piggyback on a little bit of what Corey said. And again, getting back to the collaborative piece where, we all have our own little pieces that we try to fit into the puzzle to come up with solutions for people. The same solution doesn't work for everybody. People have different needs, with Angel's Watch having the ability to house a whole family, which includes dads. That's a real challenge because we have women's shelters, we have men's shelters or transitional homes, but we don't necessarily, a lot of times in communities, have places where a whole family or a dad with children can go. And that's one of the great advantages, I think, that we have with the Angel's Watch shelter. But just to get back to, where we fit in, I guess, Charles County Department of Community Services is not a direct provider of services for the homeless. We do have the housing authority in our department, but housing authorities look different in different communities. And some of them are nonprofits, and the nonprofits or those that have a nonprofit arm tend to be more engaged directly in, service delivery to the homeless. And in our case, we don't have that. We don't have emergency housing that, just like we don't have a walk-in shelter that you don't need to have pre-reservations for or arrangements made for. But we do have a tremendous amount of service availability for preventing people from getting to the point where they're homeless. So we have folks who are living, at below poverty level who really can't afford to live in this community. A lot of them are working families, and they are doing their best to try to provide for themselves and their families, but they just can't make it in this economy and in our culture right now with things being so expensive. So the biggest focus of what we do in community services is really on the prevention. Our housing choice voucher program is a great example of that. The monthly subsidy that somebody needs in order to afford housing in Charles County is extremely important. And if we weren't providing over $10 million a year in subsidy payments for housing assistance, think about the number of families who would otherwise then also be on the street, because that's what they are literally at that point when they, are participating in our program many times. And then, just interacting with our partners. One of the other big contributions that we try to make is searching for funding for our nonprofit partners who are the boots on the ground, who are doing that direct work in the community. And I'll talk a little bit about that more later when we discuss funding opportunities and how, contributions that, the county makes in that regard. So I think we're sort of, I wouldn't necessarily call it a safety net, because that's not necessarily the right, description, but we are working on the prevention side and collaborating with our nonprofit partners to address specific needs. Great example of that is that we've been very fortunate the last 2 years to be able to secure some unexpected funding from the federal government to do a hypothermia prevention program in the winter. And because we don't have the staff or the expertise the way that our Lifestyles partners do, we granted that funding to Lifestyles to make sure that when the temperature drops below freezing for a sustained period of time, that we have people who can get out of the cold so that they don't freeze or experience other hypothermia risks. And so, that's something that, we're always out looking for opportunities to provide assistance to those who are more the boots on the ground. And then we have our role, in the programs that we administer. And together, I think, we address a larger community issue than if we were working in silos or didn't have access to those resources on behalf of our nonprofit partners.
And Ms. Barkley, you make a great point, and I want to kind of circle back and say, so I know, Ms. Goodwin, you described mostly federal funding coming in and then going to the state level. But Ms. Young and Ms. Copeland, you are both the nonprofit partners. So Lifestyles and Catholic Charities are the 501c3 partners. Thank you.
Well,
Dr. Sanders, talk to us about Department of Social Services and how it thinks about homelessness, how it's impacting homelessness in Charles County.
So as you've already heard, while we may not have specific actual shelters or anything that are tied specifically to the department, we have wonderful collaborative partners. And we really rely on our partners such as Angels Watch and Lifestyles when we are working with families, because what we try to do, we try to provide preventative services such as, eviction prevention and different things like that. Also assessing families for the other services in which they may qualify. Because while sometimes you just need assistance with a utility, and if they could take that money and put it towards the utility, and then they can take the additional money and put it towards, being able to be in a fixed location and not experiencing homelessness, or if it even keeps them in the hotels and different things longer, we will try to support those issues. So we try to connect families in the services that they qualify for, because of course, as a government agency, we have a limited sometimes definition of what people qualify for or where the income level, because when you talk about the poverty level, there are the working poor in this county, and people forget that. And it's really hard to sometimes live in the county when you're making minimum wage. I think Corey spoke about that earlier, because we have families that are trying to piece it together, but then they don't necessarily qualify for certain services because they make too much for the number in their household. So we try to work with our partners, and we try to utilize funding that we receive from the county to support utility payments, as well as sometimes we'll work with lifestyles regarding hotel stays if we have that funding available, but it's very limited.
I've heard each of you say, and it the amount of creativity and flexibility that each of you, and Ms. Young, you straight out said, like, this is where we have to get innovative. But I appreciate hearing each of you say that so much of this funding, so much of these services come with pretty strict guidelines. So it's trying to figure out, I can't pay for this, but if I could pay for your utilities, could you use for this? And we can't do this, but could you do that? And I think that brings me great hope and optimism that this isn't just a black and white, you do not qualify, we cannot help you response, but that when somebody needing services comes into our county, between each of you and your agencies and your departments and your organizations, there is the desire to try to find a way to make it work.
Absolutely.
I would say that all of us at the table and a lot of our other important partners who are not here with us today, we all got into this work because we're passionate about helping people, and we have a really hard time saying no. So we try really hard to come up with ways to say yes. And it does take a lot of creativity and really, coordination of resources across multiple agencies and different programs. So, like Tanisha was saying, like, we might not necessarily be able to pay your mortgage or your rent payment this month if you're not already enrolled in one of our programs. But if we can get you some food assistance, or if we can help you with your electric bill, or, we can connect you up with a better health insurance program so that you can afford your medication, so you're not choosing between medicine and food, all of those things are part of the solution. And we all, the health department is not represented here today, but they have amazing programs as well. And it really takes all of us working as a community to try to come up with, like I say, either you call it putting together a puzzle or putting together a patchwork quilt. Like, there's little pieces of things that we can all do. And there are over 500 nonprofit organizations in this community who are working hard every single day to try to address unmet needs in the community and to identify new unmet needs. Like, there's things come up all the time that we're like, haven't really done that one yet.
Right.
But,
This is true.
Let's figure it out.
I've been in the county for almost 29 years now working in human services, and I still am surprised sometimes with, well, there's a new question that hasn't come up before. And I think we all experience that from time to time, and the creativity and the unwillingness to say no unless we just literally can't come up with a way to say yes. Is a commitment that I know all of our organizations share.
Thank you.
I want to say we are very close. We are a very close-knit group, and we communicate very closely together and frequently to help our families in need.
Beautiful. Ms. Young, you were going to say?
I was going to say timing is important too. So while as agencies, we have certain grant sources that kind of require funding to be spent in certain times. So there may be times when it's easier to say yes at the beginning of that time frame. And then as the funding dwindles, it may likely be sometimes a no. And I think that's the reality of things. We do not have an endless source of funding to assist everyone with the full amount of their need. I think the other thing from the people we are serving, they need to understand the time frame that it takes to actually help them. So I think sometimes, and it's a bigger conversation than just talking about homelessness, but our goal is to prevent people from being homeless too. We don't want people to experience going through homelessness because it's much more challenging to bounce back from that than to keep people permanently housed. But it's really hard when someone comes and they're coming to our door today and they have an eviction for tomorrow. It most likely will have to be a no because there's not enough time and support that can be given to do that. And I think it's important from the public to understand that perspective from us as agencies. We want to be able to say yes. I hear somebody tell me all the time, we want to get to pathways to yes, but it's really hard to do that when we don't have the timing and what we need from the public to be able to help give them that yes.
Yeah, I was going to say, I think we're all talking about the way in which we think about homelessness, which on paper is a lack of housing. But the causes of homelessness are based on what we're talking about here, right? That you didn't have enough money or enough time or enough choices, right? Mm-hmm. And so if we can get the public and people who are asking for our services to think about what is preventing them from keeping their housing as like a system problem, then you can go to the right place to get some of those other issues met so that you can keep your housing. And then you don't get to the end where you don't have enough money for your rent or your mortgage and you have to leave again, which is very traumatic. What is your life looking like that's preventing you from being able to get to it? Yes, on its basis, it looks like my inability to pay my rent. But what got me here? Yes. And that's a harder conversation to think about and have. But again, if you start earlier, if you're asking the questions of yourself and of your community earlier, I think you can prevent yourself from getting there.
You have more options.
Correct. Yes. More options for assistance than just
asking for rent.
Yeah.
Yes. Right. Yeah.
And I think that, it's so, we think sometimes what's most apparent seems the most important, and housing is such a foundational need, but that it's not a standalone need.
No.
That
we
can, right. It isn't an easy thing to fix. If it was, we wouldn't be sitting here today with the amount of time and work and energy and passion and money that's gone into this. If this were fixable, clearly.
It's not just a Charles County issue. It's a national issue.
It is.
So I think it's really hard when we get some of the tough questions about, well, what are you doing about it? Or how can you do more or whatever? When I think, not to diminish it, because we do care about each individual person and their journey, but if this was a problem that somebody had figured out how to fix, it wouldn't be nationwide.
Like it's nationwide,
and you're talking about really small towns that have great networks through faith communities and things like that, helping each other. They still have people experiencing homelessness. You're talking about urban, or areas where they have the big walk-in shelters and lots of investment from cities and things like that to try to address those issues. The problem might look a little different in different communities, but it's in every community. And I think it feels a little overwhelming at times to feel like there's all this, like, what is Charles County doing? What are our partners doing in Charles County? Like, what is anybody doing? Like, we haven't figured this out anywhere yet. And so until we really have bigger solutions that, address all of the issues that lead to homelessness and keep people homeless and things like that, we're all just kind of doing the best we can and spinning the plates and trying to work with each other to come up with solutions on the fly sometimes. And it's heartbreaking sometimes to realize that it's such a bigger problem than what we can handle right here in our community.
Right. Because we do get a lot of that, like, well, it's not like this in DC. Why is it like that here? Or it's not like this in Prince George's. And I'm like, we're Charles County, and we really do, for lack of a better term, piecemeal a lot of our services together, because if there's something that we can't pay for, we're reaching out to Lifestyle and saying, if we can cover this, can you cover that? Or, contacting the schools saying, what do you have available for the children who are in the home? Just trying to work things through together, because it is really that coordinated function of service delivery. It really, it's
not going to work if we can't connect.
If we can't connect together, yes, because we don't have just like one place that does everything. We don't have that, so we have to work together in the areas in which we are available.
So I think you bring up you've each kind of touched on this a little, some of the myths and facts, and not having a walk-in shelter is one. What are some of the other myths and facts, if you can share, that you wish you could dispel?
Oh, that if you come into shelter, you automatically get housing. Not going to happen. It's not available.
So that's a big one. Something you hear.
Yeah, and I think that some people feel like, if I hit this low, then I get something as a result. Yes. And unfortunately, that's just not the case. So again, if you can prevent it, please don't allow your family to fall on homelessness if you can prevent it, because it doesn't automatically mean that you will get housing. Full stop.
Or even a priority.
Right.
Yeah, priority. Just because you're on a shelter wait list does not mean that prioritizes you for the housing that's available. There's lots of people in front of you and lots of steps you may not even recognize you haven't taken in order to get the housing you believe you deserve. And everyone deserves housing, but it may not be the housing you think you should get.
and the resources,
Right.
the housing resources in themselves. Because speaking with Lifestyles, and I know Corey, you can speak more to this, talking about the number of families that you literally have waiting for those resources.
Yeah, more than 400 on our wait list in Southern Maryland waiting for shelter.
Yeah. What are some of the other, Ms. Young, myths that you wish you could dispel? Give us your top ones. I know we don't. I know you have a lot.
So I think one of the challenges is talking to the public about where does the funding come from, and there is a very limited amount that the county specifically provides about homelessness. Much of the funds, especially for our agency, don't want to speak for all nonprofits, but much of it comes from federal and state resources. They're considered pass-through funds. So while we have a great partnership with Department of Community Services when we're talking about the hypothermia funding, and we're grateful for that because that replaced us being able to do our Safe Nights program, which most people have known us for. So with that hypothermia funding, we were able to hotel folks during inclement weather times. But those were pass-through dollars that came from federal to state then county. It was not specifically county tax dollars. And so I think people being able to understand that and how limited county tax dollars support the homelessness in this community. And I think that's an advocacy piece because in other jurisdictions, there is a larger piece of the county tax base that supports human and homeless services programs. And we're in a deficit, as everybody knows, statewide and in the county trying to figure out resources. But it is a challenge when you're trying to make sure people have employment here, have everything else they need here. But if we don't address the homeless and housing issue locally, it will continue to impact the larger good in the community. So I think helping people understand where the funding comes from, that these are all dollars that we apply for. Nothing is just given to any agency. I would love it if that's the case, but we have to do the work to apply for the funds. And because of our community, we are a very wealthy community. So from the outside looking in, we're competing with other wealthier communities. And so trying to explain the need here, which is very unique because we're still very rural area, is really hard to compete against your Prince George's and your Baltimore City and Montgomery County. So I think helping people understand that the funding is really critical to us being able to not just maintain what we have, but to even want to increase it. Because I think as an agency and as communities, we want to do more, but we have to have the funding to support the doing more, which means where's the funding going to come from? And that's an honest conversation.
Thank you. And Ms. Young, you used the term hoteling. Can you just give a quick definition of what that means?
I will. So we look at hoteling as a short-term resolution. If a shelter bed is provided to someone, and our desire is, if there is a standalone shelter bed that's available for a household, that is the first choice. If there isn't something available in the region that works for that household, then yes, there may be hotel funds that are available. As an agency, we have very limited hotels that will work with our population, and that's just the unfortunate truth. So if those persons have already been banned from those hotels, if there's no longer rooms available, because now hotels have become housing for many of our community members. So if there isn't a room available, we're kind of in a situation where we cannot assist someone for that night. But the goal is, if you want to go into shelter and there's space available, that's the choice. If people decline that being the choice, then we have decided that we cannot hotel. And our goal is not to just maintain folks in hoteling. If you can spend that much in hoteling, maybe we need to have a conversation about how do we find you more permanent housing. Because if you're being hoteled, you're probably spending at least $3,000, close to that every month. And so maybe there's some housing that could work with you to be able to transition you. So ultimately, the hoteling is a short-term resolution to hopefully providing you more of a plan of how to move forward.
Thank you for clarifying. Ms. Goodwin, myths that the school system, I think, has to kind of face and explain.
Yes, I really think that the myth might be for the community. It's not just, our homeless is not limited to just the families who are living in the homeless encampments and public spaces, and it's not limited to those who are living in the shelters. Obviously, through our conversation today, there are many families like living in the hotels, and also many families that have found neighbors and friends who are willing to take them in when they've lost housing. And we also have 300 students who do not live with their birth parents or their legal guardians as well. And they're considered unaccompanied homeless youth. And so most of them are living with relatives, but they're also living with friends and neighbors and members of the community who are willing to take them in if the parent is unable to find housing with their students. So I think that's one thing, is the awareness of homeless is not a limited definition or term, is one thing. And the other thing is that I will have parents who do call and say, I don't have a home and I'm homeless, but they might have other arrangements. And so there are times I've had to really explain the legal definition of homelessness in regards to the school system to parents who call in seeking help and assistance with their students and where they attend school.
So being able just to, we talked about how complicated the definitions can be, and that for people to understand that there are these clear guidelines that have to be met.
Correct.
I imagine that's really challenging to explain.
Yeah, it can be.
Dr. Sanders, myths that you wish Department of Social Service could
that we can share and respond to individuals on social media. So social media, I mean, it is a public space, free speech, the whole nine, but we can't speak to, if they are blasting our agency, we can't speak to that because one, there's confidentiality. And of course, you will never hear our side of the story, if that makes any sense, because we have to respect the individuals, say what you must, and we will just accept it. And we take it on the chin and we keep going and we provide service because we may already be providing service to the individuals. Sometimes those individuals have maybe been banned from hotels, as Corey spoke about earlier, or they have, exceeded the amount of services that we could provide, or we provided them all the services. They just maybe not received what they wanted. And we have regulations, federal regulations and state guidelines and policies that we must follow when we're working with our customers as well.
So it's not that your teams are not noticing that you're getting blasted on social media, it's that you can't do anything about it.
Yeah. We can't do anything. We're not going to chime back in. That's not true. No, we're not going to do that. We're definitely, we see it if there is someone that is on social media, and we will reach out to them directly, like through our Google site, and say, is there anything that we can do to support you, or would you mind reaching out to the agency? And we will try to work behind the scenes, but we would never respond, negative to a negative post or anything like that.
Thank you for clarifying. Ms. Barclay, a myth that Department of Community Services wishes they could.
So I'm going to give you a couple quick ones, and then I'm going to tell you my favorite one.
Okay.
Well, so we have one of the myths is that, public agencies like social services and community services have emergency housing. We do not have emergency housing. And unfortunately, that's something that comes up quite a bit. We have folks who just, show up in our lobby and say, I was told you have, this for me. And, like I say, our least favorite thing to do is to say no, but we really don't have it. And I think one of the other ones is that we don't have a housing authority. We absolutely do have a housing authority, and we are doing an awful lot in this community. We're not really, out tooting our own horn or putting our brand on anything, but that doesn't mean that we're not working in the community and doing a lot of services for people that either prevent homelessness or, keep people safely and housed in quality, safe places and things like that, even doing total home replacements and essential home renovations with grants and state and federal programs so that people who do own a home aren't losing their home or it becomes uninhabitable. So those are some of the things that, we're uniquely doing. But yeah, we don't have emergency housing. And I think, that's a myth that's hard to overcome. But one of my favorite ones is that, don't you see these people out here? I think there's an assumption that because you see somebody who's living in a tent behind, in a wooded area somewhere or something like that, that nobody's helping them. And I think it's I'm surprised Corey didn't bring this up because we've talked about this a lot. It's a really uncomfortable space to talk about people who look like they need a lot of help and do not want our help or do not want our judgment about how they choose to live. And it's really a hard thing, I think, for people in the community who really want to see everybody taken care of to appreciate or understand that we have all been out to talk to this individual and to try to offer them services and different living conditions and all those things. And there are people in our community who really don't want our assistance or would like to be left alone, quite frankly. And we've had people tell us those words, literally, like, I just want to be left alone. When are you people going to stop asking me about XYZ? I'm fine where I am, and it's a really hard thing for us to hear. Like I say, we're the people who don't like to say no, but I think it's even harder for people in our public when they see someone sitting, outside of a store, trying to sleep or whatever, and they don't understand, why are we helping these people? Mm-hmm. And I think it's a really challenging experience for those of us who are helping professionals to try to explain that we are tasked really with serving without judgment and not imposing our value systems and choices on other people. And when they're ready, we want to let them know that we're still here for you. If you change your mind, if you get too cold, if you get hurt and need medical assistance, please, here's our card, let us try to help you. But we really need them to be part of the solution, because we can't force services on people or assistance on people who are not ready or willing to accept.
Well, and I think, we are calling these kinds of conversations collaborative because they involve so many components from each of your work. But part of that collaboration is obviously the person. Mm-hmm. And I think that's an important one to remember.
Yeah.
I feel like we could be here having this conversation all day. I want to wrap up with two questions. We've talked about one of the things that is working is the idea that while each agency, each organization can't fix everything, that the way that you all are working together is a positive, that we're trying to fill gaps with the resources we have. I'd love to hear briefly from each of you what's not working and what you need. And I know that that's a tough one to say here briefly, but if we could do just what do you wish we had? What do you need? And then I'd like to wrap up by asking, what's one thing you hope that our viewers, our community will take away from these conversations? So, Ms. Goodwin, if you don't mind, I'm going to start with you and ask,
Sure.
what do you need? If you had the magic wand, and we talked about it doesn't exist. This is a nationwide issue. It's existed for generations. But if you had more, what would you need?
I think our families need more affordable housing options here in Charles County. That's what I really think. So many families that lose housing so quickly and have very limited options. I think if there were more affordable housing choices, that even when families have, like, they're renting a place and then the landlord decides to sell. Mm-hmm. I've had families, they're paying rent but not able to find another place to rent, and then they become displaced. Mm-hmm. And so that to me tells me that there's a lack of affordable housing.
Thank you for sharing. Ms. Young.
I'm going to take Bethany's wand and say the same. Yeah. I think having more options for affordable housing at all levels of income is important. So I know we're talking about people who are at the low income level, but we have people who are working in our human services fields that can't even afford to live here. So I think the conversation about housing is just affordable housing, regardless of your income, is necessary. I do think that there is a piece of housing that should have some components around supports in place, because what we've also seen is, while it's important to transition people to permanent housing, for some households, they need some support to maintain it. Mm-hmm. Everybody hasn't had their own place before. They may not know what goes into paying rent on time, or communicating with their landlord, or even purchasing a home. So I do think there are some elements of having some supports that will assist with some of those life skills, because homelessness and housing is just as Blair had mentioned earlier, it's a bigger conversation that needs to be had, and having other agencies that can help go in the homes and work with those households on it so they don't return back to homelessness. I think it's a key part of providing the housing. And I will always say funding, but funding not just to do what we're doing now, but it's got to be a bigger conversation with all sectors at the table. Economic development is important to this conversation because we have to provide people with the income to maintain whatever they're going to have. So I think there's various aspects of all of our county and nonprofit partners that needs to have a bigger conversation at the table.
Thank you for sharing.
Mm-hmm.
So I'm going to take all of their information.
We're just going to keep building on it. I love it.
So I think it's a system that's what I would like. It's a system that's flexible, right? So that at any entry point, a person who was close to experiencing homelessness or literally homeless had a choice. So we talk about people living on the street. That is a choice they're able to have. If they were to come to the system, what would work best for them? So for example, in other jurisdictions, there are shelters that allow for couples without children to go, or a person with a pet, right? Because some people don't want to leave their pet, right? Or somebody needs, as you were talking about, transitional housing. They don't need to go directly into shelter. They need to go to a place that allows them to save their money a little bit and work on some things for a period of time. There are people who need to go in a place that need support, but that's their permanent place where they're going to live, right? So it needs to be a system that's more inclusive to our community. And the second piece is the funding to do that, right? It's the money that allows flexibility for nonprofits to design a program based on what the community needs, and also to support, those really hard services and people who are going to need that support that are not going to fit these, softer programs. So it is, more collaborative effort. It is more housing, and it's more housing to meet different kinds of needs because our population is so diverse.
Thank you for sharing. Absolutely. Ms. Barkley, what do you need? What would make this better? What's your magic wand?
Well, the funding, obviously. I want to talk a little bit first about what we're all doing really well. So, Corey alluded to the fact that most of the funding that is utilized and available for resources in the community is grant funding. It comes from other places, whether it's state programs, federal programs, things like that. And, we don't have a single grant writer person in county government or in any of our agencies pretty much. And so we're talking about people who have all these other things, the hats that they wear and all the different programs that they're administering and all the different things that they do every day to keep the, plate spinning and all the programs running and things like that. And we're trying to write for grants and try to seek money and look for new resources out in, the grant world or whatever. So that's really challenging. I do, like I said, we weren't going to toot our own horn, but I am going to toot a little bit here because I went back and I had some help from our folks in Fiscal Services Department to look at the resources that have been brought into Charles County through those efforts in the past, I'm going to say 2.5 years, because I don't want to go all the way back to the start of the pandemic, because there was all kinds of, temporary things that came in large volumes of money, but they're all gone now, But in the last 2.5 years, through collaborative efforts within county government with our partners and things like that, we've brought over $36 million into Charles County and supported over 30 different nonprofit organizations to do the work on the streets and who do, the case management and all those other things that need to be done in order to try to address this problem. And I think that's really phenomenal. Is it ever going to be enough? Absolutely not. It's never going to be enough. But I think it's phenomenal that we've been able to pull all of that resource together and bring it into our community. And that's a huge amount of money to not only, write for and get and manage, but to deliver to customers. And I think that's really important.
So keep the funding coming.
Just a little bit.
No, I think it's important. I think sometimes we hear, not doing enough. And it sounds like we have so far to go before we get it fixed, but we are doing a lot.
What we can.
Yeah.
Yes, what we can.
Dr. Sanders, what's your magic wand?
So, of course, I think we've all said funding, affordable housing, and then also the understanding of the community that affordable housing doesn't mean there goes the neighborhood. Affordable housing involves so many people because we have people that may work for the federal government and have a decent salary but can't afford to live in the community, or if they're renting, for example, I know Bethany spoke to that. If a house is sold from underneath them, now they have to figure out how, because people live paycheck to paycheck. It is a reality that is, commonplace, but that doesn't make them any less a good neighbor when you're talking about affordable housing. And then also having those services in place to support those individuals who may have never had housing or understand yard maintenance and different things like that. But we really need to, I think, change our perspective on affordable housing and what that truly means to the community, because they are your neighbors. They are the people that are going to work every day and gainfully employed, sometimes underemployed, but gainfully employed. So it's just making things reasonable and equitable for everyone.
Thank you for sharing.
I like the term soft infrastructure, so like even if we could build all the things and have all the places, that soft infrastructure is what keeps people stable and secure and fed and, with their medical care and all of those things. And I think that's something that hasn't grown with the pace of our growth in our community. So putting, a lot of people have heard me say this, if you've heard me in any other forums that we've talked about stuff like this, that putting a roof over somebody's head is like step one of many other steps that need to happen, and learning how to live in community and learning how to take care of a place that you've now been given an opportunity to live safely and peacefully in. We need to have the soft infrastructure of all the other support systems that keep people well and healthy and living, safely and stably.
And I think that's a theme I've heard you say throughout this conversation of just addressing this one component. We have to address what happens before to prevent it, and we have to address all of the steps so that when you're coming out of homelessness, you have the supports you need.
It's the tip of the iceberg, as Blair mentioned. I mean, it's just, you only see this, but there's so much going on under the surface.
Right. Thank you. Cool. As we wrap up, is there anything else that you really want our Charles County community to know about the issue of homelessness, what your agency organization is doing? Ms. Goodwin, anything else you want to wrap up with today?
I will say, with the increase of our community schools program, we will have 14 community schools programs in Charles County Public Schools, and that is based upon the increased poverty levels of our school communities to lead to that many schools being identified. And with the resources that we're providing there, we are making sure that each community school has a student and family resource center that includes a food pantry, or we like to refer to it as a food market, a clothing closet, supplies closets, a business center for parents to come in and be able to access technology to apply for work or apply for services. And I bring it up because recently with what's happening within our country now and within the area of Charles County close to Washington, D.C., the federal government workers, some of them being laid off or fired from their jobs who live in Charles County, our community schools are noticing that there are parents coming to our food markets who just a month ago did not need to. And so we're working really hard to make sure that we're supporting our families.
Thank you for sharing and supporting in a variety of ways.
Yes.
Thank you. Ms. Young, anything else you want to make sure that people walk away from this conversation?
I think it's important that we bring up kind of the process for people getting to homeless services in our community. So people understanding that there are multiple entry points to get to requesting shelter if that is something you feel is needed. And as soon as you think you may need shelter is the time when you need to start making the contacts. So between Lifestyles, Catholic Charities, social services are some of those entry points for persons to be able to sit down with staff at each of those agencies, being able to request shelter, being able to see what other resources there are, applying for public assistance benefits, anything someone thinks that they may be eligible for. We're just encouraging people to go ahead and apply for some of those resources, but start early. If you don't know if you're going to be able to pay your next month's rent, having the conversation with some of those community partners. Funding sometimes is a barrier, being able to assist somebody with future rent. However, what are the resources, getting to know now, what are those resources and getting applications so you can start with the process, I think is very important to our community partners.
And we'll make sure all the resources for all of your organizations are in the notes for this program so that people do know how to reach out. Thank you.
Thanks.
Ms. Copeland, anything you want to leave people?
Yeah, I think I would like the county to know that the person experiencing homelessness is either your neighbor or could be your neighbor, right? So I want you to use that compassion when you're making choices and thinking about how you engage with that person and your community. And we encourage you to be a partner, right? Reach out, as Craig was saying, to the agency, Catholic Charities, Lifestyles, and talk about, how you can support your community and your neighbor.
Thank you. I appreciate that. Sparkly, any final takeaways you want people to?
Agree with everything that's been said so far. I would say that, having people get engaged to be part of the solution is really important as well. And that can look like a lot of different things. It can be volunteering your time. It could be making a charitable donation to an organization that does do direct services in the community. I know that our nonprofit organizations have been struggling financially just to continue operating and delivering the services that they do. And, charitable giving is a big part of their budgets. Like I say, the grants are great, but they are very restrictive and they require a lot of, regulatory compliance and all of those things. So, but getting some of that, less restrictive funding through charitable contributions can help us to do things that are a little bit more on the fly and maybe, have some flexibility that we might not otherwise have with those public dollars.
Thank you for sharing. Dr. Sanders, final takeaways.
So for us, the Department of Social Services, everyone who reaches out will receive an assessment. And even if that assessment doesn't qualify them for maybe certain programming that we may have, we will work with our partners to link them. And we pride in doing warm handoffs and reaching out directly so they know to expect that someone else is coming to their agency or different things like that. So I think our communication and collaboration just between our groups as well as others that aren't here today is just essential. And the fact that we want people to thrive in Charles County overall.
Yes, it's beautifully said. Thank you. A good note to end on that, reach out early if you think you need help. There's such variety of help available. This help could be needed for any one of us, and how we can help at every level, including get that assessment, find out if we can support you so that nobody in Charles County feels like there's nobody out there helping them.
Absolutely.
Thank you all so much for taking the time out of your day today. I know your incredibly busy schedules and being here to share this information. I can't thank you enough.
Thank you for having me.
Thank you for having us.
Thank you. And thank you so much for tuning in, Charles County. You've heard ways that you can learn more. You've heard ways that you can get more involved. And even if you don't have the time to volunteer, or if you aren't in a position to support financially, please pass along this information, pass along this education. It's a great way for our community to support each other, is to learn more and have information and share it. Thank you, Charles County. Take care, stay safe, and stay engaged.